drug I researched was Felbamate. It is an anticonvulsant drug, so it's used to treat epileptic seizures specifically. Its IUPAC name is 3-carbonoxyl-2-phenylpropyl carbamate. Formula is C11H14 and 204. Molecular weight is 238.24 grams per mole. The brand name is Felbamate, and it's actually not available in generic form in the US. And prior to 1991, there were only like 6 generalized anti-epileptic drugs in circulation. And the reason this one is so good is because it has less sedative effects and cognitive impairment than other alternatives. So uses, treats epileptic seizures. It's especially effective in treating Lennox-Gastaut syndrome. These are the other types of seizures it's used to treat. Historical alternatives. Some of them are still used today, like some people use herbal remedies and fasting. Spiritual rituals not really used anymore, but they used to think that seizures were caused by demonic possession, so they would do exorcisms to try to get rid of it. Really didn't help, but and then another treatment which is actually really effective is brain surgery, but it only is helpful if the seizures are like concentrated in one area of the brain, because a lot of them are generalized, so that means that they affect like all areas of the brain, but if they're partial, then it is only like from one place, so if you like eliminate that one place, then it'll go away. Okay, so Felbamate was first synthesized in the 1950s from an anti-anxiety drug, and the anti-epileptic effects were only discovered 30 years afterwards. It can be used in addition to other drugs, or as the only thing to treat seizures, which is kind of adjunctive monotherapy. And something that was kind of unusual about it is that it was tested on children in clinical trials, because they had to test to see if it would have effects on like development and organ toxicity. It was actually retracted from the market a year after it was put on, because they found side effects that they hadn't found in the clinical trials, which included liver failure and aplastic anemia, which is something to the bone marrow. But since it was so effective, they put it back on the market, just issued with a different warning so that people would know of those potentially fatal side effects. Okay, pharmacodynamics. So basically what it does to help with seizures is it decreases the rapid fire of brain cells during the seizure, and it does this by regulating GABA and inhibiting NMDA, which is another neurotransmitter. It blocks sodium and calcium channels, and that's like how it gets its anticonvulsant effects. And while it's taken, it slightly decreases respiratory rate and slightly increases heart rate, but it doesn't do so in a way that is like dangerous. It's just a nice side effect that happens. There it is. Okay, these are the side effects: decreased appetite, nausea, vomiting, insomnia, dizziness, drowsiness, headache, and then those are the potentially fatal ones that they found after they've already started using the drug. Okay, pharmacokinetics. It's ingested orally. It's usually a pill, but I think it can also be like a liquid in suspension. You take it, it's metabolized in the liver, goes through the bloodstream, and it has to cross the blood-brain barrier, which it does easily, because obviously to act on the brain has to cross the barrier. It's excreted through the urine, and it has approximately a 23-hour half-life. It can be less, though. This is the industrial synthesis route. I could read that, or you can just look at the picture. Okay, I don't really understand.